CC90009 is actually an interesting molecule. This is a molecule that is part of a number of agents that are being studied basically to modify what I would call, the garbage disposal mechanism of the cell. So the way that the normal cells basically get rid of proteins is by tagging them basically in a process called ubiquitation. And after this process happens, the proteasome will get rid of those bad proteins, and this is how cells survive. So there are significant abnormalities that happen and upregulation of certain proteins that are important for different cancer cell progression, including leukemia cells. And this agent is one of new agents that are basically similar in the idea to lenalidomide or pomalidomide, in which those agents would modify the cereblon ligase activity so that it would tag certain proteins that are important for the leukemia cell survival, and basically reduce proteins that are very important and subsequently leading to cell death. So I think it's a very interesting molecule. This study is still ongoing. It's a first-in-human phase 1 study with a dose escalation. We are still trying to define the best dose that is being, I guess, used for subsequent larger cohorts. So far, basically, what we have found is that the toxicity has been manageable. We did observe some hypocalcemia, which is an on-target effect of this agent that is usually well managed by calcium supplements. We saw some hypotension, but that's also usually well managed by giving the patients steroids. And generally, patients have tolerated the drug quite well. We continue to explore the dose, but I think what is very exciting for us at this point is that we already saw some responses. So some patients have achieved complete responses. And for me, in a patient population which is relapsed refractory acute myeloid leukemia that is very resistant and very difficult to treat, to see some responses, I think that proves the relevant biology of this pathway and its manipulation. So I think the next step in terms of this work is to better understand the extent of these responses and how can you modify the schedule in a way to optimize the efficacy and minimize any adverse events. And this is what we continue to do at this point. So I'm excited to present some of those data in the European Hematology Association meeting, and I look forward to seeing more results that come out from this study, I think, about a very interesting molecule.